Hi, I'm Kimberly Branham Nelson from Nelson Associates Insurance, and welcome to today's Healthcare Timeout. We're here with Mary Catherine, nurse practitioner at Ackerman Cancer Center right here in Fernandina Beach, Florida. And we appreciate you bringing us into your clinic here and showing us all of the things that you have to offer the residents of Nassau County.
I'm Amelia Island. I am the nurse practitioner here at our Amelia location at Ackerman Cancer Center. I've been here for 3 years. I actually live on the island as well. So as a nurse practitioner here, we see patients for follow-up with history of cancer. We assist in diagnosis of cancer, treating symptoms and side effects, of treatment or of their cancer, and just kind of walk patients through every step of the way.
So I am Galen Scuderi. I'm a diagnostic radiologist and the director of women's imaging at Ackerman Cancer Center, Amelia Island. I'm also a proud Nassau County resident, and it's my privilege and pleasure to be able to serve women in Nassau County for the last almost 8 years now. We're very proud that we started the first diagnostic breast imaging and biopsy services in Nassau County and are still the only providers of breast biopsy services and in-person diagnostic breast imaging for Nassau. So a great opportunity to serve our community and particularly to serve the community in which I live.
So Mary Catherine, good to see you. And we're finding ourselves in the treatment room here at Ackerman Cancer Center. Can you tell me a little bit about the kind of treatments that patients might receive here and the services that we're able to offer? Here we are in our treatment room. This is actually our treatment machine here. And we treat all kinds of cancer and non-cancerous tumors with our radiation machine. Radiation, what it does is targets the cancer cells and creates minimal damage to the surrounding tissues. We're the only radiation center here on the island. We treat all kinds of cancers, from skin cancer, breast cancer, prostate cancer, various cancers. Also, in our Mandarin location, we have proton therapy, which provides the same cure rate, just a different type of radiation that causes a little less side effects.
So what does the average treatment process look like? Like when a patient comes here and they're receiving a treatment, what does it feel like for them walking into the office? And are they feeling sensations when they're getting their treatment? Like, what does that feel like to the average patient?
So from a radiation standpoint, there's no pain at all. Patients really don't even realize that, anything's changing at the time. There can be side effects depending on which type of cancer the patient has. But we go over all of that with the patient whenever they come in for their consult, and we see them frequently during treatment to, take care of anything like that and answer any questions they might have.
I see patients every day that are so relieved by the personal touch that's provided here. We really are not a, warehouse, take a number kind of, environment. This is a very individualized, personalized, warm environment. You're not going to get some, a call tree when you call in, a phone tree. You're going to talk to somebody over the phone. You're going to see the same faces when you come in every day. The patients really feel like family by the time their treatment is complete. You have access to the people that you see in the clinic by phone all the time. This is a physician-owned practice, so this doesn't feel like a big business. This is for the heart of care. We're here to care for people. So I think that whole sensibility, the physician-owned nature of the practice really bleeds over into everything that we do here, whether it's the offering of cookies and coffee to all of our patients in the lobby, which is a very comforting thing when you're going through a difficult diagnosis or treatment time, or whether or not it's the ability of our patients to, be able to come in quickly whenever they need something. And I don't know about you, but I feel like patients can basically have access to whatever they need whenever they need it. We're here to make sure that their lives are easier.
Absolutely. Yeah, we're here for our patients every step of the way, from diagnosis, seeing them through treatment, for follow-ups. And we like to keep things personal. We like to answer both calls and actually speak to our patients, see them in person if they need to, whatever they need from us, we're there.
And it also helps patients to, they don't have to travel to Jacksonville, it's located right here. So they can have their imaging. It's great access for patients. And we're able to go over results with patients relatively quickly as well.
Now, typically for consults, you in the clinic with all the oncologists are going over those PET-CT results with patients the same day usually, right?
Usually, yeah.
Wow. That in and of itself is very unique because patients don't have to have an exam and then sit and wait for results.
Exactly.
They're getting their results right then and there. They're knowing what, and they're leaving not only with results, but with the plan.
Exactly.
The wonderful thing about Ackerman Cancer Center is when it comes to insurance, you guys take most of the insurance plans. You also accept Medicaid and Medicare patients. You also accept cash pay patients. So the beautiful thing about Ackerman Cancer Center being located right here in Fernandina Beach in Nassau County is that you can see your patients right here in your clinic and provide radiation treatment right here on site in their clinic. If they needed to go for proton therapy, they can go to the Ackerman Cancer Center down in Mandarin and receive that as well. And I think that that's a great thing because it's kind of a one-stop shop. You come in, you're treated, you're welcomed with a warm staff, and we truly appreciate all you're doing here for the residents of Nassau County.
So we accept almost all insurances from United Healthcare, Blue Cross Blue Shield, Ambetter, Medicaid, Medicare. If you have any specific questions, you can always call our main line and speak to someone in the intake team. They can answer any questions regarding insurance. So if you're interested in being seen or even for a second opinion, you could give our office a call at 904-377-2700. We're located in Building A, right beside the hospital. Or you could go to our website at ackermancancercenter.com and fill out a patient form. You don't need a referral to come see us.